Norovirus. Noroviruses are a group of highly contagious viruses that causes gastroenteritis, which is the inflammation of the stomach and intestinal tissues. This leads to a series of gastrointestinal problems, most common being diarrhea, vomiting, and stomach cramps. Norovirus have been known since at least 1929 when a pediatrician first described it. It was called the winter vomiting bug at that time. Then, in around 1968, an outbreak of this disease occurred in an elementary school in Norwalk, Ohio, and thus the virus was named as the Norwalk virus and later renamed as norovirus. Coming to the characteristics of norovirus, norovirus are non-enveloped viruses belonging to the family of Caliciviridae. It is positive stranded RNA virus and is also called as the perfect pathogen due to its ability to evolve constantly, high contagiousness, rapidly shedding nature, and ability to survive without a host for a long time period. Coming to the transmission, norovirus is transmitted mainly through the fecal-oral route. Contaminated food and contaminated water is the most commonest route of transmission. A person who is infected also sheds the virus, which may pass on to other people caring for the patient. Norovirus can also spread by changing diapers, shaking hands, and touching contaminated surfaces, and then eating food without washing the hands. A person infected with norovirus will start showing symptoms within 1 to 2 days of exposure. The symptoms include low grade fever with or without chills, diarrhea, vomiting, usually projectile in nature, abdominal cramps, body ache, fatigue, and headaches. Norovirus usually causes only mild illness, and the person will start feeling better after a few days. But when it infects the children and older age group, it may become serious as it can cause dehydration in these age groups. Thus, it is important for people infected with this virus to drink lots and lots of water to compensate for the fluid loss during vomiting and diarrhea. To diagnose norovirus, a polymerase chain reaction assay will be done on a blood sample. Now, coming to the treatment of norovirus infection usually does not require any specific treatment as it resolves within few days. The only care required for patients suffering from norovirus is to prevent dehydration and to prevent the transmission of this disease. Due to the severe diarrhea and vomiting that occurs, a lot of fluid is lost from the body. If fluids are lost, it will not only reduce blood volume but also decrease a lot of important electrolytes which are required for the proper functioning of the body. Thus, a patient of norovirus must have a lot of water to meet the fluid loss. ORS solution, lemon water, dal water, coconut water, and fruit juices can also help along with water to maintain the overall fluid and electrolyte balance. Now, to prevent the transmission of this disease to other people, it is advisable to the patient to quarantine themselves from other people, to practice proper sanitation, to wash used utensils and clothes properly and not to share them, and also to maintain social distancing from people. Norovirus is not a fatal infection and can be treated with simple home remedies.